All right. Hello, everyone. We have a special video today. As always, my name is Arya,
I'm Josiah.
and we have a very special guest today, Dr. Omar Awan. He's been a great mentor to Josiah and I throughout this whole journey in med school. He's vice chair at education at the University of Maryland School of Medicine, as well as the director of medical education for radiology. So it's an absolute privilege to have him today. Thank you, Dr. Awan.
Oh, thank you, Arya Josiah. Yeah, I love doing this and always happy to help whoever we can with respect to, training and medical students and residencies.
Absolutely. Yeah, I know right now is a crazy time for all of the students. We're all applying for residency, so this would be it's a great way to kind of get in some last minute ideas before everyone presses that big submit button. Yeah. All right, so we'll just get right into the questions. So we'll first start off with kind of just some like apps and interview questions. From like your perspective, what qualities or experiences kind of distinguish like a strong applicant for radiology, like beyond the test scores and like class ranks and grades and stuff like that?
It's not just one quality, Arya. We honestly look at the whole big picture and we look at the whole gestalt of who the person is. And really, I think the thing that really makes someone shine is professionalism. And that may sound weird, it may sound very basic, but it's actually very true. But what I mean by professionalism isn't just like someone that is just professional or someone that doesn't get in trouble. It's more like how motivated someone is, like how hardworking someone is. Do they come in early, stay late? How enthusiastic they are? How much of a team player they are? These are all under, for me at least, professionalism. And when someone has those characteristics or qualities, it really allows them to shine. Obviously, other things do too. I mean, let's say, for USMLE, like, let's say you got 290. I don't know if that's possible, but, if you get a score that's like super high, I mean, it just shows that, okay, wow, this person is clearly a brilliant person. They're exceptional. They've done something that's very few people do, and that's also great, right? Someone's AOA, someone has enormous leadership potential or skills by a track record of being the president of multiple societies, or they're already known to most radiologists. I mean, there are people like that. There are some students that are out there that do a lot of things with like ACR, RSNA, and most people know who they are, or they've heard of them, So that also can kind of make you stick out. But I think honestly, it comes down to, for us, we want to make sure that we have good residents, and that really comes down to professionalism. So if that comes out in your letter of recommendation from other people that are talking about you, that's huge.
No, absolutely. No, that's definitely some great insight. I think as students, we all think of professionalism as, showing up to work, doing our due diligence, but there's definitely stuff beyond that for sure. I guess another thing is kind of going along that a bit is like what are some pitfalls you see some students making when applying to, residency for radiology, and what are some ways that we can avoid that throughout the process?
Well, one is, and I don't like to make a big deal about personal statements because I honestly, as I'm sure you've seen in some of my other videos, like I sort of downplay them for right or wrong because I just don't believe that they make you or break you unless it's like really amazing or really bad. You know what I mean, for lack of a better word. So most people are kind of in the middle, and that's fine. It's very hard to wow a program director with a personal statement, but it's also very hard to do like a really terrible job. But with that said, I've noticed that some people just focus on negative things in their personal statement, and I find that. You have to think about, your residency application as like you're selling yourself. You know what I mean? Like in a way that, you want them to interview you. You want them to have you as a resident. So why are you gonna like if you were selling a product, you wouldn't say, oh, by the way, like the half-life of this or the shelf life of this is 5 minutes or something. Like that's gonna deter someone from getting the product, right? I mean, I know it's a crude analysis or crude analogy, but in a way it's similar, right? Like you don't want to, you have a page to talk about yourself. Like, why are you going to waste a couple lines on something negative, right? You want to sell yourself. So I always tell people, don't worry about that. I mean, if they want to address something, if they want to address the fact that you didn't pass step one on the first try, they'll ask you about it on the interview. Like, why do you need to address that in your personal statement? I know there's some people that probably would disagree with me, and my opinion is my opinion. As one of the associate PDs and the vice chair of education, I'm sure there are PDs out there that would want you to address it, but I'm mind boggled by the fact that people would want to address that in a personal statement when you're trying to sell yourself to someone. So I think that's one of the biggest pitfalls that I've seen. The other is the interview. Like I think that some people just don't prepare for the interview. And that's fine. There are some people that are very good and I've seen people who have not prepared and they've done like exceptional jobs. But I think that's an exception rather than the rule. I think for most people, you should prepare a little bit. You should have, questions that you want to ask. You should have some idea of what you want to say because you don't want the interview to be very disjointed. You don't want it to make it appear that you're not prepared or you don't have insights that you want to offer. So, to me, those are the two biggest pitfalls that stand out to me with respect to residency applications and things that are very avoidable, by just preparing and looking at it and hopefully, that may resonate with some people who are applying this cycle.
Definitely. No, there's some great insights, definitely things to look out for on the application trail. The thing is, now that we're all getting close to, and I'm sure everyone's going over the signals over and over, as Josiah and I have, kind of grasping our hair. But any advice on how to like distribute our signals across programs for radiology? I know they changed the number recently, so it's now 6 gold and 9 silver for diagnostic rads. Any insight as to how we should distribute it? Should we mostly do go for targets? How many reaches? Kind of like how would you recommend going about, spreading those programs across?
Awesome. Well, first of all, I just learned something because I had no idea that I thought it was 6 gold and 6 silver, but I guess it's 9 silver now. So this is breaking news to me. So I appreciate you guys telling me that. Uh, Listen, I think just use signals. I think, there's no science to it, quite frankly. I think a mistake would be to not use them.
Mhm.
Quite frankly, a mistake would be to, only use 4 or 5 gold and a handful of silver. Just they're a gift to you, and I've always said that. I think I've said that in other videos and other panels as well. It's a way to express your interest in a program, a way, especially if you think that you're not on their radar. Like, let's say for you guys, Aria, Josiah, you guys are here at University of Maryland. Let's say you want to go to UCSF, or let's say you want to go to Stanford or University of Washington on the West Coast. They may not know that you're interested in the West Coast because you're on the East Coast. You know what I mean? But if you signal them, it'll it'll give them pause. It'll be like, oh wow, okay, this person, they only have 15 signals to give. They've signaled me. Clearly they want us to respond, or they want us to interview them, or they want us to give them their attention, right? So it's a way for you to attract attention to your application. I think that's how you should look at it. So my sense is you should use all of them. And use them at the ones that you want to hear from. Like if you were to apply and you didn't hear from them and you felt bad, that's an indication that you should signal them. So that's what I would say about that.
No, that definitely makes sense. No, that's really helpful. I know it's like the signals have been such a crazy thing. Like, everyone's talking about different strategies about that. And, we get like around 15 this year. Say, just because there is like a finite number of signals, what's a way to like show an interest in a program outside of signals? Say you love all these programs, maybe that 16th program, for example, that quite
Mhm.
didn't make it on a signal. What are ways you could show interest or show a connection to a program in that case?
It's tough to do, and I'll explain why. Because if you do that, let's say, for example, you email them. Let's say you send them an email and say, hey, I would love to interview at your program, which is fine. And you probably should do that if you haven't heard from. First, I would first say be patient. Like I wouldn't do this right away, like in September or even early October, because you want to give you remember, some programs don't even give interviews out to November. So not all programs. I mean, we certainly don't. We certainly give them, earlier on. But I know for sure there are programs that wait a little bit. So you want to be patient. You don't want to overwhelm a PD because they're going through like over 1,000 applications. You know what I mean? So you want to be patient. But then, you can consider emailing them. But the problem with that, Aria and Josiah, is that they're going to know that you didn't signal them. If you use 15 signals and they weren't one of them, they're going to wonder, well, how interested is this person really in our program? Because they had a chance to offer 15 signals and we clearly weren't one of them, right? So you have to kind of remember that. You want to be genuine and sincere, and there's no easy way to do it, quite frankly. And that's something that I struggle when I mentor you guys and give you guys advice. It's hard to do it, but we also understand that you guys need to get interviews, and you may not get an interview at every place you signal, right? And you want to maximize your chances as applicants. We understand that. So I think most BDs would welcome an email. You know what I mean? Like they may not respond. In fact, you shouldn't expect a response because they're so busy and they're getting multiple emails all the time from all sorts of applicants. But they're gonna read it. You know what I mean? Like, I mean, I can't imagine someone would just delete emails. Like most PDs read everything. They're gonna read it, and if they like you and they think, oh, okay, wow, like Josiah has a pretty solid application, and he's telling me he has a connection. Or if you do it strategically, there's things that you can do in like a letter of interest that I've talked about. Feel free to look at one of my videos on my channel. MedEd page. If you do it in a way that attracts them, then you never know. They may offer you an interview, right? So. There's no harm in doing it. You don't obviously don't want to overdo it, and one email is enough. You don't want to do multiple emails. They'll read your email. They're not gonna, even if they don't respond, they will have read your email. So uh, give it your best shot and see what happens.
Yeah, no, definitely. That definitely makes sense. We appreciate it.
Great. Sort of our last series of questions on the match process itself. So along with that, on interview day, are there any ways to like show a specific interest in a program, especially without having visited a program, or if there wasn't like a
Yeah,
virtual interview, and all you sort of have is what's on the website? Are there any ways to show a particular interest in a program?
I would say treat the whole day as an interview. And let me explain what I mean by that. Not just your 3 or 4 interviews that you have, like those formal interviews by faculty members or perhaps chief residents or something like that. So you will likely be greeted by one of the program managers. Be nice to them. That's part of the interview. You know what I mean? Like not for all programs, but for a lot of programs. I will tell you that at University of Maryland, Riku Lantaya, who's our program manager, we ask him, and he gives us feedback, on who was nice, who was, more charismatic, or who was, very friendly or easy to get along with. We like that input, and he's a big part of our program. I consider him no different than any other faculty member, or a chief resident. I mean, that's how much I value his opinion. You know what I mean? Uh, and even another way to show interest, I think, is a lot of programs in between interviews. So you'll have downtime, like you'll be interviewing with a faculty member, and then you may have like 20 minutes before you interview someone else. Use that like sometimes they put you in a breakout room with like other residents. Talk to the residents during that time, like that downtime. That shows interest. That's an answer to your question. You'll be surprised at how many people turn their cameras off and just chill for 20 minutes, and then there's nothing wrong with that. I'm not saying that that's a red flag. That's not what I'm saying. If you choose to do that, let's say you want to go get coffee or something, fine. But if you want to show interest and you want to make a impression, keep your camera on and talk to other residents because they're going to remember that. And I can't tell you how many times residents have told me, when we're talking about ranking applicants, oh wow, yeah, this person, you know, he was interacting with us, he or she was interacting with us, during the downtime. They ask great questions. I mean, that elevates your profile. You know what I mean? In a lot of ways. So I think even these subtle things that don't get talked about a lot can have a really important and profound impact.
Sure. Yeah, that's really helpful because I'm pretty sure, like me and Ari, at least most of us, our med school application process was the start of these online application or online interviews. But still, there's some unspoken rules about the virtual process, which most of our interviews will be. Um,
Yeah.
so that's helpful. Moving more on to residency training itself, are there any aspects of residency training that you see medical students often underestimate or overlook when deciding radiology as a specialty?
Well, I think it's hard for medical students to really know what radiology is all about just because you don't really understand it until you're doing it. You know what I mean? Like I know most med students, I know both of you have gone through rotations in radiology. I've seen you, in the reading rooms and stuff. And I know you would kind of understand the workflow and what radiologists do, but you're not going to really get it until you're actually doing it. And I think there's a steep learning curve in radiology because as you know, you don't really learn this stuff in medical school. I mean, let me take that back. You learn the basics about pathology and this type of stuff, but no one's really teaching you imaging findings per se, or differential diagnoses for certain things. Enlargement of the pancreas, what's the differential diagnosis? 99.9% of medical students wouldn't be able to answer that question. You know what I mean? Uh, but if you ask them what's the differential diagnosis for leg swelling, unilateral versus bilateral, I'm sure most people would, right? Because they teach that. That's part of clinical vignettes for, DVT, congestive heart failure, nephrotic syndrome, et cetera, right? So there's a difference, and most medical students won't get how much you need to learn in radiology. There's a lot of studying that needs to be done in radiology, especially the first couple of years when you're kind of trying to catch up and trying to get ready for call. So I think that's something that uh, med students may underestimate or may not fully grasp. It's the funny thing is it's like you're going to do a 1 year. This is how I kind of explain it to some people. You do a 1 year internship in medicine or surgery, and then you do radiology. Like I remember when I was doing my internship in medicine, by the end of the day, I was tired, but I was tired because I was like walking around the hospital. I was walking around the entire hospital all day, rounding on patients and stuff. In radiology, after a day in your first year, you're tired mentally. You know what I mean? Because you're using your brain. Like there's no downtime for your brain. Like you're like constantly thinking about stuff. So like you come home, it's not a lot of physical exertion, but you're mentally drained, which I wasn't when I was doing medicine. You know what I mean? So I think that may give you a glimpse as to how it's a little different.
Okay, that makes a lot of sense. I can see that in some of the residents I'm rotating with right now. I like to get in that lunchtime fatigue. So okay, moving sort of to a very similar line, but are there any common misconceptions about just attending hood, like radiology as a specialty beyond residency that you see students have, or just any general like things you would want to clarify about the field of radiology?
Listen, I think as an attending, I don't know. I think it's a phenomenal field. I mean, would I do it again? Yes, 100%. If I had to go back and choose again a specialty, I would 100% choose radiology again. It's just such an amazing field. It's versatile. You can read studies, you can do procedures, you can interact with patients. Uh, you know, you can work from home, you can work at the hospital, you can work at a clinic, you can work overnight, you can work during the day, you can work part-time. I mean, you see the flexibility and versatility of radiology. How many fields can you say that about? I don't know any that I could really say that about. You know what I mean? Like it's just such a unique field, so powerful, so fulfilling. You're impacting so many people. I love education and I'm able to do that. Like I do radiology, but the thing that I care and I love most about this field is interacting with people like you, teaching you guys stuff about radiology, interacting with residents, teaching them how to read studies, interacting with fellows, getting them proficient so that they can go out and do good to patients. That's the beauty of what I do. That's what I love about what I do. And, everyone has a different passion and you're able to fulfill that, no matter what your angle is. So I think that in a lot of ways is sort of the beauty of radiology. And I think that you come to learn that as you do it more and more.
Yeah, great. I think definitely you've shown, like me and Aria for sure, how many opportunities there are for radiologists beyond just patient procedures, to have a lot of human interaction, and like the really important role that you can have in education with a really broad knowledge across specialties. So, something we've definitely seen from you. Um, Moving to some of our last questions, there's always this discussion of AI and new technologies in the field, but in general, do you have anticipate any challenges or opportunities that future radiologists will face that is different than prior generations have had?
Definitely. Well, and I think you mentioned it with AI. I think AI is going to definitely impact our field. It already is impacting our field. We use AI. In radiology, we use AI software to help us diagnose things like head bleeds, for example, uh, looking at breast tumors on mammograms. Uh, Radiologists that don't adopt AI and embrace that AI will suffer because it's going to be a part of our workflow. So I think it's critical for this next generation like yourself to learn AI algorithms, understand what the limitations are for AI because it'll be part of the workflow. And what we do in radiology will change. But we're needed. It's not like AI is going to replace us. That's not what I'm saying. What I'm saying is that AI is going to be a part of our daily workflow. So it's important for us to learn AI, understand what it is, understand what bias means for AI, understand that there are ethical limitations for AI, and know how to use it to make us more efficient. I think that will be something that will be very essential and critical for the next generation of learners as they go through diagnostic and interventional radiology, quite frankly.
Great. Yeah, I think you explained that very nicely. Wrapping up, again, as we're approaching ERAS, and residency soon, is there any main pearls of advice you have for students interested in or soon to be entering radiology at residency? Anything that you wish that you knew as a resident or opportunity to really shine in your residency training?
I would say come in with the mindset that you want to learn. You have to have a thirst for learning, and that's something that not everyone has. You'd be surprised. You would think that everyone would have it, but not everyone has that. So, be very open-minded, be willing to learn from everyone. I think all different attendings have something to offer you. Your peers have something to offer you. Being close to your residency class is going to be critical, for your success. Getting to know them as people because they're going to be the people that are going to be taking call with you. And then also just making a commitment to study and learn, because the more you study and the more you learn, the more you're going to succeed in radiology and radiology residency. So if you make a commitment to sort of read daily, even if it's 30 minutes or 45 minutes a day, you will be unbelievable at the end of your first year because you'll have read so much. So that short amount of time, even though it's small, when done consistently, can have a huge impact on the trajectory of your career. So that's the advice that I would give people. Just have an open mind, be willing to learn, and be consistent in your studying and learning of radiology.
Excellent. All right, that is the end of our questions. Thank you again so much for taking the time to speak with us. And this has definitely been useful stuff for the both of us, and I'm sure for everyone else who's able to tune in. So,
My pleasure. Thank you so much for having me. Really appreciate you guys, and thanks for all the great work that you both do.
all right, we appreciate it.
Thank you.
Well,
Good luck to everyone on the interview trail and application season.
yes.
Same times.
All right, we'll stay in touch. Have a good afternoon.